Missouri Department of Health and Senior Services offers home visits for those families at risk that intervenes with parenting skills and childhood development. Their main goal is to improve the health of a child in a family-friendly environment by making a personal impact on families. In addition to those goals, home visits are cost-effective for the society because they promote lifelong development to these children in need and to successful members of the society they are in. Home visits have been active in the state of Missouri for many years and hope to support these at-risk families and their infants. The goal of home visits is to improve infant and maternal outcomes, child health and education outcomes, and parenting skills and self-sufficiency. In March of 2010, President Obama passed the Patient Protection and Affordable Care Act, which provided $1.5 billion for funding for 5 years for evidence-based home visitations. Missouri has already had funding for these home visits. We just need to educate people in the county and state on their purpose and their benefits. This is a prenatal risk assessment used by our community health nurses to determine the risk of pregnancy.
So your pregnancy test was positive, and so this is a risk assessment. I'll just ask you some questions about your health history. Is this your first pregnancy?
Yes.
Okay. And how old are you?
25.
Did you graduate from high school?
No.
No. Okay. Do you smoke?
Yes.
How much do you weigh?
120 pounds.
You've had no other previous pregnancies? No. Do you have high blood pressure?
Yes.
How about diabetes?
Yes.
Do you take insulin for your diabetes?
No.
Okay. Have you been tested for HIV?
Yes.
And what was the results?
Positive.
And do you live alone? Are you married?
No.
Okay. And do you have a history of alcohol or drug abuse?
Yes.
Okay. And how about your partner?
Yes.
The father of the baby. Okay. Are you with the father of the baby?
No.
Okay. Any physical or emotional abuse?
No.
Any neglect of children in the home?
No.
Any history of violence?
No.
Any chronic or recent mental illnesses?
No.
Okay, because of your, you have two or more risk factors, you're considered a high-risk pregnancy.
Okay.
So because of your smoking and your health problems with the diabetes, blood pressure, HIV, and considering you're a single mom, you are considered a higher risk pregnancy, and you do qualify for our prenatal case management, which would be a nurse coming out to your home once a month, taking your blood pressure, your weight, listening to fetal heart tones, and then doing lots of prenatal education.
Okay.
Is that something you'd be interested in?
Yes.
Okay. Have you got signed up for WIC yet?
No.
Okay. Do you know where the WIC office is at?
Yes.
Okay. So you can call this number and set up an appointment for WIC. They provide nutrition while you're pregnant. And then also after you have the baby, if you choose to breastfeed, they can help you with a pump. And they can also provide you with cereal, cheese, milk, and things like that while you're breastfeeding. And then help if you decide to formula feed, they can supplement the formula.
Okay.
So that's a great program, and you can get a hold of them. Also, the Doula Foundation. Have you ever heard of a doula before?
No.
Okay. You do qualify for a doula too. Some of the services that a doula can provide are whether after the first or after I think the last 4 weeks of your pregnancy, they're on call 24/7. They're that companion for you during your labor. and they're there for your support. You also qualify for the childbirth classes and the prenatal yoga, and then they have itsy bitsy yoga for after you have the baby.
Okay.
Do you have any other questions about anything?
No, I think that's it.
Have you set up a physician yet?
Not
Do you know where you? Okay. Do you know where you want to deliver?
At St. John's.
St. John's. Okay. So we signed you up for temporary Medicaid today. So you are eligible to see all of these providers. If you want to go to St. John's, then you'll look here. This is the St. John's doctor, and they take temporary Medicaid, which is what you have. So you can call and get signed up for temporary Medicaid, or signed up for a provider. Yeah.
Thank you.
You're welcome.
According to the Missouri Department of Health and Senior Services, between 2005 and 2009, there were 52,175 preterm births and 32,390 low birth weight infants. In 2009 alone, there was 5,525 reported child abuse and neglect cases. From 1999 to 2009, there were 232 homicides of children from the ages of 1 to 14